A difficult birth can change a modern room in seconds. Someone calls for blood, a surgeon is brought in, the lights move, instruments appear, and the woman on the bed may never see half of it happen. Move that same crisis back into prehistory. The baby is still stuck, the bleeding is still real, but the room is gone. For roughly 300,000 years, our species faced birth without transfusions, antibiotics, or emergency surgery. Human birth was no easier then. A baby's head and shoulders still had to pass through a space barely large enough for them, often turning on the way out. Sometimes they could not. So, how did ancient women survive childbirth? First, many did not. Birth could kill the mother, the baby, or both. But when it worked, survival may have depended on something almost invisible in the archaeological record: another person. The reason begins with the pelvis. Walking on two legs changed the architecture of the human body. The pelvis had to support the organs above it, anchor muscles used in upright movement, and still leave an opening for birth. Meanwhile, human infants developed large heads and broad shoulders. The old explanation made this sound like a contest between walking and big brains. Researchers called it the obstetric dilemma. That idea still matters, but the current picture is messier. Fetal growth, a mother's available energy, the pelvic floor, and a pelvis doing several jobs at once may all shape the problem. The result is a birth canal that works, but with very little room for error. Unlike a straight tube, the human birth canal changes shape from top to bottom. The baby usually rotates as the head descends and turns again so the shoulders can pass. In many births, the infant emerges facing away from the mother. From that position, she may struggle to see what is happening or guide the baby without injuring it. Anthropologists Wenda Trevathan and Karen Rosenberg have argued that this difficult rotation may help explain why assisted birth is such an old human behavior. One person still does the labor, but another pair of hands can alter what happens next. A helper could brace the mother, watch a part of the birth she could not see, and receive the infant as the shoulders turned. If the baby needed warmth or the mother began to weaken, another person was already there. None of this made birth safe. Obstructed labor, severe bleeding, infection, and exhaustion could still be fatal. Help did not remove the danger. It created a few more ways through it. Proving that help existed is difficult because midwives do not fossilize. A hand held during labor leaves no mark on a pelvis. Advice passed from one woman to another leaves no stone tool. Ancient bones reveal the physical problem far more readily than the people who responded to it. Historical and ethnographic records offer clues, although they are not photographs of the Paleolithic past. Across different societies, women have given birth kneeling, squatting, sitting, standing, or leaning on another person. Experienced relatives and attendants have watched labor, suggested positions, and stepped in when they recognized trouble. These communities have their own histories, so they cannot simply be copied backward into prehistory. What they demonstrate is narrower. Organized birth care does not require a hospital or a written medical system. Before textbooks, knowledge could remain in the group. People could remember which positions had helped, what a dangerously long labor looked like, or how to support someone who was losing strength. Some of their practices probably worked, some probably did nothing, and others may have caused harm. There was no single prehistoric birth manual, only local experience carried from one delivery to the next. Then, if mother and baby survived, a second problem began. Human newborns are unusually helpless. They cannot walk, find food, or cling to their mothers as many young primates can. The mother, meanwhile, may be injured and exhausted, but still need water, warmth, protection, and calories. She may also have older children depending on her. This is where assistance around birth becomes part of a larger human pattern. While the mother recovered, someone else could bring food, keep the fire going, carry the newborn, or watch the older children. Researchers debate exactly when extensive cooperative childcare began, but humans now rely heavily on care from people beyond the mother. The body created a difficult birth. The group supplied part of the answer. Look again at the modern delivery room. Its monitors, drugs, and surgical lights are recent. The arrangement around the bed is not one vulnerable body, surrounded by people watching, remembering, and ready to act. Ancient women were not magically tougher than women today. Experience, position, and assistance may have improved their chances, but none could solve every emergency. Many women and infants still died. We cannot know who attended the first assisted birth or what she understood. We only know that the problem was too difficult to remain one person's problem forever. Long before anyone could stop the bleeding, someone could refuse to leave.